Welcome to the Southwest Florida Real Estate Update, hosted by the York Group of Downing Fry Realty. Our show will bring you the most up-to-date information on the local real estate market, presented by leading experts in the field.
Welcome to our show today. I'm here today with Dr. Gregory E.Leach of Advanced Medical, and we're going to talk about the current pandemic today and the situation with getting vaccinated. And before we get into that, Dr. Leach, let's tell them about yourself and your practice that you have here that we're sitting at.
Well, I'm a family physician, and we have a practice called Advanced Medical of Naples.
Mm-hmm.
And our practice is a 7-day-a-week practice of family medicine. But we also provide urgent care services, which really is part of family medicine.
Mm-hmm.
People need to be seen same day for whatever, and we take care of that. And in addition to that, a portion of our practice is occupational medicine. And occupational medicine is really servicing an employer, because many people don't really understand what's occupational medicine mean. We service the Cuyahoga County government, City of Naples, and multiple other smaller employers for anything that they need. So that's what we do. And I think because of that, we're been called upon lately to deal with the epidemic, which is, I think, you wanted to talk about that.
Yeah, I think that's, today there's, I guess we're having some spikes and we live in Florida and Naples, and, I thought you're an expert in your field. You're seeing patients all the time, and you're a very knowledgeable doctor. You're always keeping up on things, and I thought it'd be a good topic for our viewers to at least educate them about what's going on and what they should do if they haven't been vaccinated, or there's the Delta strain coming, right?
Mm-hmm.
We could talk about that. How do we deal with that? And I'll just let you start because you're the expert on it.
Well,
I'm
the expert in the trenches.
Right.
I will say that I am not an infectious disease specialist, and obviously I would defer to them for accuracy if needed. But we are in the trenches. We're seeing patients 7 days a week.
That's right.
And depending on how hard we're hit with this epidemic, the latest, and you use the word spike, and I will sometimes I pick at words.
Mm-hmm.
Okay, these are media words.
Okay.
Used to create fear and distort truth.
Mm-hmm.
And I'm not saying there's not a lot of cases, but surge, spike, all of these things, when in fact we really need to be talking about what's actually happening. Correct, we have a different strain, the Delta strain, which is more infectious, can spread quicker. So that's why it's caused such a rapid increase in August.
Okay.
July, August of this year, 2021. But we're seeing in our office, we're a little bit battle weary right now because it's been about 4, maybe 5 weeks, a tremendous increase in volume of seeing patients that are sick, patients that are not sick, patients that have pneumonia, patients that we need to admit to the hospital, patients whose oxygen saturation level is below 90. They're in respiratory distress, sitting still without even moving. Those patients always need to be admitted. So we see all across the board any number of patients, just like that you would see in the emergency room.
Mm-hmm. So
we need to stratify those patients. We need to treat those people.
Right.
And most people, go home. Most people are not that sick. They're sick. They feel sick, but they're not sick enough to be admitted. So it's been an interesting increase in the number of cases. But this is by and far, and you may have heard, pardon me, you may have heard it said that this is by and far an epidemic amongst people that are not immunized. 90%, it's because people have not been immunized. So that's people say, well, there's some confusion about, well, you can quote, I will use colloquial speech. You can still get it.
Mm-hmm.
Of course you can. 10% or 8% immunized. They got it, but it's mild, goes away. This is normal, typical medicine. When we're treating patients, if you just ignore coronavirus for just a second, and we'll talk about, I shouldn't use the word influenza because everybody's trying to put them all together, but I will use influenza as an example because every year we have a surge or an increase in flu. Everybody's familiar with that.
Mm-hmm.
It comes in the winter. In the summer, it goes away. So that increase in influenza we see all the time. That's why we get an immunization, is to prevent or partially prevent the flu, but really to prevent bad influenza, which kills people.
Mm-hmm.
And many out there don't know that influenza kills people, but it does. Every year we see those patients too. So it's no different, with that than it is with coronavirus in terms of how immunizations work or don't work. It's unfortunate that the simple facts have been distorted by non-medical people, media outlets,
Right.
For whatever reason, and that has caused fear and confusion amongst patients. That every day I am talking to patients because they ask me, well, do you think I should get the virus, get the immunization,
Right.
or I'm not getting the immunization, and so we go back and forth with just educate and explain to people what this really means. So, yeah, it's been interesting.
So just define, because we were talking about this the other day, people that are younger are kind of more against it, maybe because they're about having babies, if it's a woman or whatever. Just clarify that for us.
Well, there's a lot of Voodoo Science out there. Voodoo Science was a book written by a PhD level physicist, 10 or 15 years ago, maybe longer. Voodoo Science was the premise that if enough people say something, people start believing that.
Mm-hmm.
That's Voodoo Science, which means it's not science at all.
Right.
So these things you hear about, fertility and women, and
Right.
this is just not factually correct. So you see any number of these rumors that spread, and it's very simple just to go vet that or use critical thinking, and you can very easily find that that's just not the case.
Mm-hmm.
And that's just one example. And so people become fearful when they hear of all of this. And there really has not been, think about this. How about 100, 200 million Americans or more, have been immunized?
Right.
Maybe more than that. I don't know the exact number. And worldwide, billions have been immunized. With the, there just isn't any. There has not been any problems with the immunization. So it's probably the largest case study in the history of the world of how many people have been immunized with the. So if something would have occurred, it would have occurred already, and it has not. So I think people are operating based on fear. The other thing is, we were talking about earlier before we, about what is an epidemic? I mean, what does it mean, epidemic?
Mm-hmm.
Does somebody need to be immunized, yes or no? Epidemic means a rapid increase in the number of people that have an infection, and therefore easy to transmit because so many people have it.
Right.
And then you get this rapid increase. So the more people that get sick, the more people die. So that's the purpose of trying to get an epidemic under control, is to prevent people from being killed. So the concept of epidemic, and let me use this, let's get away from coronavirus as a specific example. Let's talk about whooping cough. We were all immunized against whooping cough, pertussis.
Right.
The CDC for a while now has been saying we have a whooping cough, epidemic, if you will, and there's and we've all been immunized. Well, why would we have this? Because two reasons. There are people that are not immunized. Uncontrolled immigration of people that are not immunized, and Americans that choose, for whatever reason, not to immunize their children. Because of that, you have a reservoir of people that are not immunized,
Right.
and then therefore they can get whooping cough, and then you can get it.
Right.
So now they're saying that we, as adults, need to have a booster for whooping cough because of this epidemic. Once that gets controlled to where there's less people that have it, then the, quote, epidemic is gone, and we still need to be immunized, but we don't need when we say immunized, it means we're making your antibody level higher. Antibody kills. So we need a higher level of antibody. That's the purpose of immunizing somebody. So immunizations to make the epidemic go away. And, younger people, we have been told, well, it's not as bad amongst younger people.
Right, that's right.
Yeah, they are at less risk to have significant injury. But I will tell you, with this current epidemic in the non-immunized group, we're seeing a large number of younger people because they're the ones that are not immunized. And they are very sick, some of them. So we know that occurs. And
so let's talk about the booster shot that's coming.
yes.
Just tell our viewers a little bit, when does somebody get a booster shot? When, what is the booster shot? Like we were talking about that yesterday, it's the same vaccine, right? It's not a different vaccine.
We are, let me just say, this is depending on when this is aired. We are on the CDC website almost every day. And multiple websites to figure out what's happening with the epidemic, how many cases, what is it doing to people. And the CDC originally came out and said that they're going to authorize a booster 8 months after your last shot.
Right.
They just, a few days ago, reduced it down to 6 months. So 6 months after your last immunization shot is when you would get it. And they would usually roll that out just like the first time with,
Right.
Healthcare people get it along with people with comorbid conditions,
Right,
people that are weak. They'll get it first, and then everybody else will get it. So, and we are supposed to be getting, if I, for example, received the Moderna vaccine, I would get Moderna as the booster rather than mixing it up. So I think that's what the current recommendation is. But as I said, we keep checking the website. So
And people can check that website too.
So sometimes this information is like, well, people get the infection even though they're immunized. Fine, that's normal. They need a booster.
Right.
Well, there's something wrong because you need a booster. No, because we get boosters all the time. And we receive immunizations. I think I used an example of when somebody comes to work in our office, we check their hepatitis B status, because hepatitis B can ruin liver, among other places. And we can get hepatitis B when we stick ourselves with a needle. So we need to check to see if we've had hepatitis B or if we are immune. Now, generally, we get a hepatitis B immunization. If you work in healthcare, you get one of
Right.
them. You want one of those, so you don't. So if somebody, we draw their blood, and do they have enough antibody in their blood? Fine, they don't need a booster. Or if they've never had the immunization, we give it to them. But if there's not enough antibody in their blood, then they welcome a booster in order to. So, I mean, this is common everyday activity. And the only difference here is something new, but it's not that new because of the number of doses that have been given since the beginning of this year.
Mm-hmm.
You know, we're what, eight months,
That's
just
right.
about 9 months through this. So, we encourage. The thing is, we as people get embedded in one part of the equation, which is, should I get the immunization? The problem is they're not analyzing the full.
Well, right.
You've got, should I get the immunization? Then you have the disease over here.
Right.
Well, the risk of the disease far outstrips any risk, and there's been no risk of the immunization.
Right.
But over here, you have an individual, should I get the immunization? Should I get the immunization? But really, they're forgetting about the disease. It's unfortunate because they don't see what I see.
Mm-hmm.
If they could come, I say this to patients about many things. I say, if you could come with me for 1 week and see what I see, you would be scared. You would run to get the immunization because you would not want that.
Right.
But the real issue is, yes, you don't want to get disease, but there's a broader and more responsible issue, which is you want to make the epidemic go away so nobody gets the disease.
Right.
Or more importantly, so that the weak people don't get the disease.
Mm-hmm.
Because if the 25-year-old comes in and they said, well, I don't want to get the immunization, and they infect somebody, that person would die.
Right.
And I had a physician, one of my friends and colleague, die 5 days ago
Mm-hmm.
from coronavirus.
That's right.
And he would not be dead, in theory, if there would be no variant of Delta now,
Mm-hmm.
because there would be nothing to vary from. Because if we had all been immunized to start, the epidemic would be controlled and there would be no Delta variant.
Mm-hmm.
So now that's not coulda. I don't want to say coulda, shoulda, woulda.
Right.
Coulda, shoulda, woulda. All I'm using that as an example, just to teach so people understand why is it that they should receive or volunteer to get the immunization. It's not about self. It's about everybody else and our economy. If people relate to that, it was a tremendous mess. It still is a tremendous mess.
Sure is.
So,
Well, Dr. Leach, I appreciate you coming on the show, and I think we've helped our viewers today understand more, and if they have any questions or need to be seen, they certainly can come to your practice here at Advanced Medical, located on Goodlet Avenue. And
we're at Goodlet and 7th Avenue North. We're doing a tremendous amount of coronavirus tests. I mean, if somebody needs a test, we do tests.
Yeah.
We do all of the tests, antibodies, and we see patients that are ill. So specifically as it regards to coronavirus, we can help people out or just answer their questions. But we don't force people on anything. We just teach.
And you're open 7 days a week, 12 hours a day, right?
Yep.
The only days you're closed during the year are what days? Christmas, right?
Not very well. My staff wants me to close more, but
Right, I know.
Christmas, New Year's,
it's
Thanksgiving.
Not very much.
I'm trying to remember. Maybe Easter.
Yeah.
I sound like a slave driver, but no, we're here because people like us being here when they need us.
That's right. That's what you're here for.
Yeah.
So, Thank you very much, Dr. Leach.
You're welcome.
Thank you for tuning in, and we'll see you next week. Thank you.
Thinking of buying or selling a home in Naples, Marco Island, Bonita, or Estero, Florida? Think of the most experienced York Real Estate Group, associated with the #1 brokerage in Southwest Florida, Downing Fry Realty, which produces yearly real estate transactions of over $1 billion. Jim, Michael, and Morgan make up the York Real Estate Group of Downing Fry Realty, with over $275 million in sales transactions, along with offering over 25 combined years' experience in the local market. The Yorks can offer the experience and trust you need in a realtor. Call them today at 239-273-6727 or visit their website at www.naplesyorkrealestate.com.